Medicine continues to change every day, and the doctors responsible for this are now doing what they can to share this information and news. Introducing Regenerative Medicine with Dr. Escobar, a new approach to pain management here in Florida. Dr. Escobar is board certified by the American Board of Anesthesiology, the American Board of Pain Medicine, and diplomat of the American Academy of Pain Management. He has been practicing in the area for over 15 years. He has lectured in the community as well as mass media on various topics in pain management. As a leading provider of interventional pain management in Aventura, Pembroke Pines, and Hollywood, Dr. Escobar works hard at treating the source of your pain with the goal of restoring you to full function in your normal life and activities. If you wish to join the conversation or have a question, please call 888-565-1470 and talk with Dr. Escobar. Now, here is Dr. Escobar and today's show.
Hey, good afternoon. This is the Rejuvenation Show with Dr. Luis Escobar. My name is James Vandenbosch. It looks like I'm going to be the host here for this tonight. How are you doing today, Dr. Escobar?
I'm doing very good, James.
That's great. That's great. Now, I know what type of physician itself. We know you're a pain management physician. How long have you been doing that itself?
I have been doing this since 1991. I train in anesthesiology and specialize in pain management. And I've been doing a combination of both until the last 10 years when only on pain management. And for the past several years, have specialized into regenerative medicine to complement the pain management and to restore the patients back to normal life.
Right. So now you're bringing stem cells into your practice.
That's correct.
Okay. And with that aspect of it, what are your goals in that regenerative process of your patients?
Well, we are trying to get our patients not to get relief of their pain, but restore their functionality back to normal by regeneration of the injuries that they might have, whatever that may be, whether it's on the spine, on the joints, tissues, tendons, muscles. So we're trying to regenerate the tissues rather than just treating the pain.
Right. Well, let me just introduce myself a little bit more. I'm, of course, James Vandenbosch. I work with Dr. Luis Escobar. I'm known as a clinical orthobiological and regenerative scientist. And tonight we're going to talk mostly within that aspect of stem cells and how your body can help rejuvenate yourself, just as Dr. Escobar explained for his patients. With the rejuvenation, is this one procedure we're going to do, two procedures? What's the normal procedure that you look for in this, Dr. Escobar?
Well, we have to, as you know, we have to individualize the treatment to every patient and to every injury. Some treatments are less invasive and less complicated. In those patients, we may use what is called platelet-rich plasma, where the healing may take a little bit less involvement of the patient's own tissues. When an injury is more severe, then we will bring, as you mentioned before, the stem cells to try to regenerate the injury rather than just heal it.
Right. So with the number one patient that you usually see itself, would it be something as far as degenerative disc disease or annulus fiber tears, or what is the most common patient that you would see in your practice?
Definitely, we will see the injuries that you just mentioned when it comes to the spine, disc degeneration, acute annular tears, disc herniations, facet disease, pain, what we call axial pain. Most likely comes from the facet joints in the spine. And all those areas respond quite well to regenerative treatments with stem cells and platelet-rich plasma.
Right. Now, your goal is to, in most of these conditions, is to calm down the inflammation within that aspect. If it was chronic, what would you do if it was acute or if it just occurred what would be your methods to go down, to follow?
The normal algorithm, traditional algorithm, would be on an acute injury. First of all, some rest, try to prevent the inflammation, and some pain medication, perhaps. Now we are introducing early treatment with regenerative treatments to decrease the inflammation with the patient's own stem cells and or platelet-rich plasma. Or we're trying to activate the patient's own response, but at a multiple of what a normal response would be. When there's an injury, the body produces certain responses via messengers. Those messengers recruit growth factors that go to the area of the injury. In some instances, that is not enough to restore to regenerate the injury. And what we do is get more of that from the patient, harvest tissues, stem cells, and platelet-rich plasma, treat it in the lab, separate the stem cells in the platelets that are rich on growth factors, anti-inflammatory factors, and regenerative factors that will then inject into the area of the injury to promote the healing process.
Right. I know one of the biggest questions, I know the news and the world itself romanticize the embryonic stem cells and fetal cord blood, all these kind of things. But with the type of stem cells you use, as we use in the clinic, would be autologous, meaning from you going back into you itself from the fat. How difficult of a procedure? Because that's always a question that comes up with patients. They think it takes days or months or something like that you have to grow. But what about for the procedure that we do and yourself? How simple is the procedure for that patient out there?
Very important point. I'm going to start with what you just mentioned is autologous stem cells. And as you explained, these cells come from the own patient, so has nothing to do with embryos, has nothing to do with any
no moral
issues or ethical issues. There's no donation from any third parties or patients. So these are tissues that are very well tolerated by the patient and almost impossible to be rejected because they are your own cells that are harvested and re-injected back into the patient. How difficult this is a very simple outpatient procedure. We do this in a matter of an hour to an hour and a half from harvesting the tissues, processing them in the lab that is in our office, and then re-injecting them under direct guidance. These are very precise injections where we use either fluoroscopy, which are real-time X-ray, and or sonography to go to the affected areas and precisely deposit those cells in at the level of the injury to regenerate the tissues.
So definitely having those instruments itself, it is precise. You have to have it in the right location or in that location itself. I know we've heard out on the outside world here that I've heard physicians say you just get it close to it, but you're a firm believer in having those guidance such as fluoroscopy and ultrasonic does give you that precise guidance of those stem cells for the corrected area.
Absolutely. We see the injury, we identify the injury, and precisely put the medication right where it is. And we see the stem cells going to where we want to deposit them.
Right. So where are the stem cells coming from? That's always a big point there.
Well, stem cells are pretty much in every tissue in the body. They are concentrated more so in the bone marrow and adipose tissue, in the skin, in your teeth, and synovial fluid. Pretty much any organ or fluid in the body will have stem cells. the most commonly used nowadays is bone marrow and adipose tissue.
Adipose. And are you doing bone marrow and adipose, or are you just...
We're using bone marrow, adipose, and platelet-rich plasma as well as a scaffold, if you will. Let's say the stem cells are the repairman, and these platelets are pretty much the tools that repairman uses to go in and repair those injured tissues.
Right. So with the tissue itself, actually, with the fat, is it a large abundance? I know there's a large abundance of that fat, and it's very safe to do the liposuction. I know I get a lot of questions about that, but what in general, just explain exactly the procedure when the patient comes in so they can kind of visualize what it is and what they're preparing for.
Well, it is a very simple procedure. Of course, everything has to be done on a very aseptic manner.
So sterile.
Very sterile. The patient is prepped with a cleansing solution. Local anesthesia is applied to the area. A small amount of what is called tumescent, which is a combination of normal saline, local anesthetic, and a little bit of epinephrine to prevent some bleeding that is injected into this soft fatty tissue. And once this is anesthetized, we do what is called liposuction, as you just mentioned. In this case, will be a mini liposuction because we are extracting some of the fat tissue, anywhere from 60 to 120 cc's.
So about 2 to 3 ounces. Fat,
basically,
4 ounces of fat.
if you put it on the ounce measurement,
put the ounce measure. Some people.
So most of us can give out a few ounces without having any problems.
I bet you get a lot of requests for take all you want.
Yes, that's like the number one request. Can you take more?
Is liposculpturing in your future?
No, I do not think so. No.
Okay, definitely. Well, if you want to call in, you could call us at 888-565-1470. We can also be seen on www.nnradio.com. The website, if you'd like to check out Dr. Escobar itself, is www.painconsults.com. And the office number there is 954-322-8586. All right, so let's get back to the stem cell itself. I'm sure you've seen a lot of patients that were inoperable. They couldn't have surgery or anything, or you've seen the chronic conditions after you've treated to the lengths of what conservative medicine and the medicine that you have. Does this give hope to those people, to those patients?
Absolutely. There is, like you mentioned, patients who need surgery and cannot have it for whatever reason, or patients who really need surgery and do not want to have surgery.
Right.
And those patients will be amenable to treatment with stem cells. And pretty much stem cells repair any tissue in the body. The definition of a stem cell is what's a cell that can actually replicate itself and has the potential to transform into a different type of cell.
Right.
In other words, a stem cell can become a chondrocyte, which is the cell that composes the cartilage in the joints. It may become a tendon cell, it may become a muscle cell. Right. So, having said that, pretty much the areas where these treatments will be useful any area in the body. You can use it in the shoulders and the joints and in the knees and the hips and the elbows and the joints of the hands, any ruptured tendons, any damaged muscles. There's studies of using stem cells for non-union fractures.
Okay, let me hold you off right there. It looks like we're going to head to break, and we'll talk to you right back with Dr. Luis Escobar.
Get your life back from musculoskeletal injuries faster and without surgery. At Pain Care Specialists of Florida, Dr. Luis Escobar can help you do just that with regenerative treatments of platelet-rich plasma and stem cells. Stem cells live in all of us and act like the repairmen of the body. However, during injuries, we sometimes can't get enough of these critical repair cells to the injured area. This is where Dr. Luis Escobar may help you by harvesting your own stem cells and re-injecting them into the injured area in need of repair. To find out if you are a candidate for regenerative treatments with platelet-rich plasma or stem cells, please contact Dr. Luis Escobar at 954-322-8586 to make an appointment at one of his 3 conveniently located offices in Hollywood, Pembroke Pines, and Aventura. Or visit us on the web, www.painconsults.com. Times are tough, and right now those in the commercial world know that being heard via advertisements is the name of the game. AmpSquare.tv understands how important advertisement is and is proud to express that it's truly the only plugged-in internet television production company on the market. Amp2.tv live streams all their shows across all the major selling markets in the U.S. and abroad. Call them at 866-224-5422. The AmpSquare.tv library allows productions to be seen over and over again, making commercial platforms more usable. Call 866-224-5422. Toll free 866-224-5422. Amp2.tv, the first and only internet television network that's truly plugged in. 866-224-5422. That's AMP2.TV. You are listening to Regenerative Medicine with Dr. Escobar. And if you wish to ask a question or participate in the show, call 888-565-1470 and speak to the doctor. Now, back to the show.
Hey, and welcome back. We're here at the Rejuvenation Show with Dr. Luis Escobar. We touched off on a little bit about the importance and things of that nature of the stem cells. Let's go to the goodness of the injuries itself. I know back in 2008, 2009, Tony Polamalu and Heinz Ward had platelet-rich plasma performed on their injuries 2 weeks before their appearance in the Super Bowl, in which they had outstanding performance in the Super Bowl by, I'm saying, reduction of pain. Those are just 2 incidents with Ward, who had an ACL, and Tony Polamalu, who had a high ankle sprain. How would that relate to even the weekend warrior, or just somebody that's one of your patients for that? Pick an injury, an ACL, which is a common that we see.
Well, any injury, as I mentioned before, any tendon or ligament can be treated with regenerative medicine. If surgery is not an option, then these treatments definitely become more amenable. We have to take into account when you took an ACL, that is a complicated surgery. Mm-hmm. And if you do have a complete tear of a tendon such as the ACL, I mean, surgery most likely is inevitable.
Right.
But if you have a partial tear, and we treat those with precise injections. These have to be very precise injections. You have to go into the tendon itself, on the direct combination of fluoroscopy and ultrasound guidance. There are reports out of Colorado of regeneration of a torn ACL.
Okay.
There's several reports now that they do regenerate, and this will be one of the most difficult tendons to regenerate. Meniscus tear, perhaps lateral collateral ligaments, medial and lateral, tend to be a little easier to treat with this modality because the support on the knee itself is not as critical as the ACL. But any of those tendons can be treated.
Right. And then how about what we've seen a lot of, I've seen a lot of in the clinic, rotator cuff tears, the supraspinatus tears, those tears itself.
Absolutely.
How would this work within that the same way?
Absolutely. Again, some injuries are more amenable than others. Again, if you have a full tear with separated ends, that may be a surgical case. But if you have a partial tear, those tears do respond fantastic to stem cell treatments.
Right.
Another tissue that responds quite well, that is difficult to treat, as I mentioned, the meniscus in the knee, the labrum on the hips, and there's tend to be very difficult to treat surgically sometimes. I mean,
Right.
those do respond to very well to the stem cell treatments. Labral tear in the hip, for instance, is very easy to access via injection with stem cell with the direct visualization, either by ultrasound or fluoroscopy, and tend to respond well to the stem cell treatments.
Right. So fluoroscopy, for all those out there, that's live X-ray.
That's correct.
Live X-ray there. If you have any questions, you could call 1-888-565-1470, or you can also watch us on www.nnradio.com. And I was sitting here speaking with Dr. Luis Escobar about the rejuvenation of, you don't have to be a professional sport. You could just be the weekend warrior, or just persons himself with aging on that. Besides the spine and anything there, where can you go with these stem cells? Again, it's limitless. What we have.
It's absolutely limitless. I mean, we treat in our office mostly spine and joints,
Right.
but pretty much there's other treatments for stem cells, as you know, for any condition. I mean, neurological conditions.
Again, these cells that you get are from what's called a mesodermal lineage, which can basically turn into any tissue within the body, correct?
That's correct. That's by definition. A stem cell is a cell that has the capability of duplicate, multiply, and may differentiate into any particular type of cell in the body.
Right. So it's not going to be half-life of a cell such as Dolly, who was cloned or anything. In other words, patients are going to grow an extra finger, or they're not going to grow an extra arm or any kind of abnormalities by using their own stem cells.
No. I guess if you were to try to enhance the cells or culture the cells, that could be a risk. With the treatments as we have them today, these are the cells as you have them in the body.
Right.
They are directed into the injured area, and in these particular cases, that injury itself tend to direct the cell to what to do.
So with the adipose or the fat tissue that we collect, you think those stem cells are just on reserve to be called in, as well as the tissue that has other stem cells in it?
Absolutely. Absolutely, yes. The stem cells are called in by the body, by the messengers, whenever there's an injury.
Right.
That's how we develop the inflammation when there's an injury.
So with the inflammation, it's sending out cells out through the system, the blood system, saying, something's wrong here.
Something's wrong, and all the cells are called into the area where the injury has occurred. Unfortunately, our natural healing process does not bring enough cells in most instances to regenerate this in a fast enough fashion.
Right.
By us going and get recruitment of more cells and bringing them to the area of the injury, then the healing processes multiply.
So thinking about that it has to come from one area to another through circulation. So we're talking about the circulatory area. Wouldn't you agree that it is a difficult process of healing within a knee or a synovial fluid, the joint, because vascularity or the cells aren't able to pass through, such as a muscle. And we see chronic conditions such as osteoarthritis or conditions in the knee that just don't heal and they become chronic. This is one opportunity that we're able to take, that you would agree with, that we're able to do?
Absolutely. It just enhances, multiplies the prowess of healing that our own body has. You mentioned the vascularity on the tendons and ligaments is not as good as it is in the muscles, so the healing process takes much longer.
Right.
Same thing happens on the intervertebral disc. There's no circulation, so whenever there's an injury, these tissues take much longer to heal normally. if we are able to provide more of the repairman in the way of stem
Exactly.
cells and the tools that the repairman uses in the way of stem cell of platelets, platelet-rich plasma, the healing process is much faster.
Right. I think that's why it's important to have this conversation itself, is exactly the skeletal, the muscles, those areas just don't get the adequate enough blood supply that we see in medicine, as that being one of the top conditions for seeing physicians. And if we have that option like we do now, that will be able to help them heal. It's very important compared to, again, an organ or something of that nature, or where we've gone on to other processes like treatment for neurological conditions. But with the musculoskeletal system has always been one that's always been number one with injuries. But you foresee this in the future, that it's going to help reduce down that amount of patients in pain. Do you think it would reduce down in surgeries? Because that's one of the biggest fears that are out there. That's the dinosaur on the wall here.
Actually, I would like to say that you asked me if I will see this in the future. I think we're seeing it now.
Yeah.
We are helping our patients now, as you know, regenerate faster, and yes, avoid surgery in many cases.
Well, that's great. That's so important. Again, as we talked about before, you have a lot of patients that can't or just don't want the surgery. Or how about the one patient that you've had that's had 5 surgeries, or nothing else has happened from it?
You see, the beauty of stem cell treatment is that it's not exclusive. It's actually very inclusive. Surgeons are using stem cells intraoperatively to promote the healing. It can be used ahead of surgery to improve the bed, so the healing process is faster after surgery. And it can be used after surgery if you still have significant degree of injury and or pain, to promote the healing of that injury.
Now, if we could use this, I've seen before where it's been done for hair. Would you quit? Would you quit pain management and go straight to hair? Well, it looks like
if I could get me some hair, I probably would do that.
It sounds great. Well, it looks like we're coming to the end of the show itself. I would like to thank everybody who is listening in to the Rejuvenation Show with Dr. Escobar. Again, you can always call in at 888-565-1470, and you can see us on www.nnradio.com. The pain management site for Dr. Escobar is www.painconsults.com, and you can reach us at the office number 954-322-8586.
You have been listening to Regenerative Medicine with Dr. Escobar. Join us every week for more information and news on achieving full function in your normal life and normal activities. Call Dr. Escobar for more information at 954-322-8586. See you next week on Regenerative Medicine with Dr. Escobar. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily